G'day guys, welcome to Stay Awake, where I encourage everyone who's watching to stay awake to what's really going on in the world.
It is calculated that the new generation, the generation of today, from this generation, each second man and each third woman will have this illness, the cancer.
A big portion of educating people about the truth is exposing the lies. Can someone educate someone else about something that they know nothing about?
They gave us a whole hour on nutritionals. A whole hour
in
4 years of medical school. Mm-hmm. And they told us there's vitamin A and B1 and B2 and C and D, and they're in alphabetical order, and you can look them up. And then they told us some really basic facts. We got a whole hour.
First of all, how much training did you receive on nutrition when you were in medical school? Because I know here in the States, it's almost none.
Yeah, not much.
Not much?
Not much.
Even in Argentina?
It's close to, yeah, very little.
Close to none?
Very little.
Because in medical school, they don't teach you anything about nutrition.
The word doctor actually means teacher, and so doctors should be educating their patients and teaching their patients, but unfortunately, the only thing that doctors are taught while they're in medical school is how to prescribe drugs.
We got hours and hours and hours on how to use basically patent medicines, which, as you know, are what usually goes on the prescription pad as a molecule that can be patented, which means it's not found in nature, because you can't patent it if it's not found in if it's found in nature. And that's what we get educated in.
They don't get paid to educate people, they get paid to write prescriptions. And you know, you can imagine the drug lobby made sure that's the case.
The doctor is brainwashed when he gets out of medical school because the medical school has too much subsidization of the professors who are being paid by the drug company. So the professor never teaches any student in medical school, why don't you try vitamin C? They're going to tell them the latest drug.
And that's by design, specifically. You know, there about over a century ago, there's foundations, the Carnegie and the Rockefeller foundations, who sort of engineered the curriculum through their grants and donations.
Are you wondering what Dr. McCullough meant when he mentioned that the Carnegies and the Rockefeller foundations engineered medical school curriculum over a century ago? He was referring to the Flexner Report of 1910.
When the money is coming from a source which has a vested interest in the outcome, now what's going to happen is the outcome is going to be what the donor wants it to be, generally. So this is the problem, and that goes back even further in time to the turn of the last century, when the Rockefeller group and the Carnegie group actually came together, and they decided that they would reform medical education in America.
At the time of the late 1800s, early 1900s, 20th century, medical schools taught a lot of different things. There were homeopathic medical schools, there were naturopathic schools, there were eclectic herbal type medicine schools, and so it was all there. There was not one way. And what happened was that the Rockefeller and Carnegie foundations were interested in establishing the one way. How would they do that? Well, they would get a hold of the education system and create a medical monopoly via basically eliminating all competition to patent petrochemical medical education. That's the Flexner Report of 1910, it became known. Abraham and Simon Flexner, were hired to do this. It was a preordained commissioned report.
Not surprisingly, the basis of the report was that it was far too easy to start a medical school and that most schools were not teaching sound medicine. Let me translate this for you. These natural health colleges were not pushing enough chemical drugs manufactured by who? Carnegie and Rockefeller. The AMA, who were evaluating the various medical colleges, made it their job to target and shut down the larger respected homeopathic colleges. Carnegie and Rockefeller began to immediately shower hundreds of millions of dollars on these medical schools that were teaching drug-intensive medicine.
Oh, by the way, when they donated the money, the donors would say, well, now we've given you a lot of money and we know you're going to do the right thing with it, but would you object if we had someone from our staff appointed to your board of directors, just to make sure that just to see how our money is being spent, you know. Well, that was really a condition of getting the money, so you know the university said, well, that would be fine. Anybody that you would suggest would be, I'm sure, more than adequate. So they began to load up the boards of directors of these teaching centers with people who literally were on the payroll of the donors. So once that was in place, the curriculum of the universities, the teaching centers, swung completely in the direction of pharmaceutical drugs, and it has remained that way ever since.
Predictably, those schools that had the financing churned out the better doctors. Oh, wait a minute. Or should I say, the more recognized doctors. In return for the financing, the schools were required to continue teaching course material that was exclusively drug-oriented, with no emphasis on natural medicine. By 1925, over 10,000 herbalists were out of business. By 1940, over 1,500 chiropractors would be prosecuted for practicing quackery. The 22 homeopathic medical schools that flourished in the 1900s dwindled down to just 2 by 1923. By 1950, all the schools teaching homeopathy were closed. In the end, if a physician did not graduate from a Flexner-approved medical school and receive an MD degree, then he or she could not find a job anywhere. This is why today MDs are so heavily biased towards synthetic drug therapy and know little about nutrition, if anything.
Now this whole medical field has been skewed in the direction of pharmaceutical drugs which can be patented and produce great profits for the producers. And then the next step is that means that anything coming from nature is excluded, and that's where we think, some of us think, that most of the promise lies in these very complex substances found in herbs and plants and trees and things like that, seeds. Some of us feel that it was probably meant to be that way, you know. And so you come out of all of this analysis and all of this history with the realization that the medical profession is really like a lapdog of the pharmaceutical industry. And most of the doctors have no idea that that's the case. They don't understand this history.
Only pharmaceutical conventional medicine is the medicine that is officially approved and acclaimed, and people who try to find other solutions have difficulties when it comes to insurance coverage and other problems. So maintaining monopoly on treatment is also one of the ways to protect and grow this business.
How we first discovered chemotherapy, the first chemotherapy agents in the early 1940s, was because in Italy, when they dropped nitrogen mustard gas, okay, and it was in one of these missions and all, and they were doing the post-mortem autopsies in the body, the lymphocytes of these patients dropped down. And then some of these doctors got an idea, well, gosh, someone has leukemia or lymphoma where these lymphocytes are producing too much. It was suppressed in these people that were dropped with mustard gas. So the chemotherapy agent comes from the history of actually making
mustard gas.
You said it.
As shocking as this may be, the first chemotherapy agents, and even some of the agents that are still used today, are derived from the mustard gases that were used to kill soldiers in the world wars.
There's a study that came out about 90% of physicians, particularly in oncology, would not prescribe the drug that they give to their patients to their wife or their child. Right? So what does that tell us?
He's probably not going to do his treatment. Why would you?
In 1971, U.S. President Nixon declared a war on cancer, but are we really winning this war in light of the fact that 90% of oncologists won't even take their own treatment? Is the cancer industry any closer today than they were then in finding a cure? Why does this perpetual war on cancer continue?
And one of the reasons why this war continues is the money that are being made in this war. And this refers to the treatments, so-called treatments that are being used in cancer, namely chemotherapy and radiation. Chemotherapy uses the most powerful toxins known to humans. And these toxins, of course, are being sold to us as substances that can kill cancer cells, but these substances also kill, annihilate healthy cells in the body, damage its organs, which make the recovery from cancer almost a miracle, impossible. And also the very substances that are being used to fight cancer are cancer-causing chemicals. So instead of eliminating cancer or curbing cancer, we are inducing, generating new cancers.
Tamoxifen is a drug that most women are put on when they have breast cancer, but they don't tell them that it's classified as a carcinogen by the American Cancer Society and the World Health Organization. So does it make sense to give women a carcinogenic drug that will cause cancers in other parts of her body to prevent cancer?
It's estimated by 2020 that more than half of all cancer in America will be medically induced from drugs or radiation. So our medical establishment itself will soon become the leading cause of cancer in America.
It's not the cancer that really hurts people, okay? Statistically, 42 to 46% of patients will die, that have cancer will die of cachexia, which is basically wasting of protein. They basically lose all their lean body mass. So that leaves between 58 and 54% of patients that didn't die of cachexia. And the joke, which is only maybe half funny, is that the rest of them die from the treatment. In other words, really nobody dies from the cancer. If you think about it, when a patient gets immunosuppressed and they have cancer, what actually takes them? Liver failure, kidney failure, pneumonia, sepsis. But all these things are usually associated with also the person getting chemo and radiation.
We know that 97% of people who undergo chemotherapy are dead in 5 years. That study was placed in the 2004 edition of the Journal of Oncology. It was the cancer doctors telling on themselves. Do I know this study to be true? It was a massive study done by epidemiologists who themselves were doctors. I interviewed the lead of that study just within the last 6 months. And I said, is this still true today? This was published in 2004. And he says, it's absolutely as true today as it was when we published it back in 2004, and it may be getting worse. When they tell us that chemo's our only chance, it's the first lie you hear. Then you have the surgery. The second lie is we got it all. You can't get it all if you're focused on tumors. You simply can't. Cancer's probably already metastatic. Surgery spills it. Radiation proven not to kill the stem cells, but to enhance them. Well, we always hear, well, cancer came back. Didn't come back, folks. It just never left.
But chemotherapy is not only incredibly ineffective, it's also hazardous material.
Let's look at chemotherapy, for example. Chemotherapy, yes, it can kill cancer cells. Possibly. It can kill any cell. Here's the issue that I have with chemotherapy. When I see somebody that's handling chemotherapy, making chemotherapy, and they have to wear hazmat suits and gloves and can't touch it because it's toxic, then why are you going to give it to a person who's already sick? I mean, does it make any sense? You ask a 3-year-old child this question, I would bet you that 90% of the 3-year-old children would get it. If that looks dangerous, then I shouldn't touch it. That's it.